With 20% of children in need of surgical care, the country has only 4 pediatric surgeons. It is against this backdrop that the Ministry of Health collaborated with Emergency to establish the first of its kind children's surgical hospital in Entebbe. The Minister of Health, Dr. Jane Ruth Echeng, led the team of top management of Ministry of Health to tour the facility.
This hospital will be commissioned in June by His Excellency the President. And in preparation, we have taken off time as Ministry of Health to ensure that everything is functioning as was agreed in the collaboration. This is strictly a children's surgical hospital, and it is a specialized hospital. So the children who will be received here will be children who are referred with special surgical cases. It is not only a hospital for the nation, but it is also a hospital to serve the region as was agreed in the collaboration. And in the commissioning, we'll have ministers of health from the region also come and see a hospital that has been put up for the region. It is important to know that services in this hospital are free of charge.
The Emergency Children's Surgical Hospital has 3 operating theatres, ICU with 6 beds, wards with 50 beds, sub-intensive care with 16 beds, laboratory and a blood bank, CT scanner, radiology, among other services.
This hospital is part of a broader network that we call the African Network of Medical Excellence, and that we discussed many years ago with the several ministries of health, including the Ministry of Health of Uganda. And with them, we asked to identify some health priority for the country that could also benefit the region. And the Ministry of Health of Uganda highlighted the need for specialized pediatric surgery. This hospital will increase by 3 times the current capacity of surgical beds for children in the country. We will develop a system for referral of patients with the other hospitals in the country in order to make sure that the patients that are coming here are those who really will benefit most, and we will develop this cooperation within the entire country.
Mortality rate for children under 5 in Uganda is at 49% for every 1,000 live births, and 30% of these deaths are due to lack of adequate surgery. The government of Uganda provided land for this hospital free of charge and paid 20% of its construction costs, and will cover 20% of its running costs every year. Zahara Abigaba, UBC.